Okay, well, good evening, and thanks for joining us tonight for our virtual presentation of Lower Your A1C, Tools to Manage Diabetes. I name my part of the program Strategies to Strike Sugar Spikes. Got a lot of S's in there. And my objective for tonight is to give you a better understanding of how your food choices and other lifestyle activities can affect your blood glucose, with the goal to keep your blood glucose steady and within a healthy range. So you're not always riding that blood glucose roller coaster. So first, what is a spike? It's the rise in your blood glucose after a meal. Keep in mind that it is normal for the level of glucose in the blood to rise a small amount after eating. Even in people who don't have diabetes, that happens. However, spikes can affect your quality of life today by making you feel lousy, and frequent spikes may contribute to future health problems. So while you're having a spike, you might feel reduced energy levels, slowed mental performance, lowered attention. Your moods might become a little altered. You might feel a little more sad or tense. For some people, their physical or athletic abilities may be decreased. Basically, spikes can make you feel not as good as you should. And even though after meal blood glucose spikes are temporary, several spikes day after day can raise your A1C level. And a high A1C level has been shown to raise your risk of long-term diabetes complications. So keeping your A1C in a healthy range can help prevent damage to your eyes, your kidneys, your nerves. So that's our goal. So first, just how do you know if you have spikes? If you have a meter or a continuous glucose monitor, then the best way to determine if you have spikes is to test your blood glucose. I really recommend testing blood glucose in pairs. And also, if your fasting blood glucose numbers are always within range, but your A1C is elevated, that's a good indication that your blood glucose is spiking after meals. Okay. So I think it's most helpful to check your blood glucose in pairs, which means to check your blood glucose right before a meal and then 2 hours after the start of the meal. Ideally, the rise should be less than 50. Okay. Of course, the goal is to see gradual improvement. So I always say start where you are, and gradually we want to see improvement. And you can discuss your individual goals with the doctor that's managing your diabetes too, because it does depend on other health issues. Just to give you some ranges, the American Diabetes Association goals are for fasting or before meal blood glucose to be less than 130, and 2 hours after the start of the meal, your blood glucose should be less than 180. And then again, the rise from before to after the meal should ideally be less than 50. And in that case, the goal for your A1C would be less than 7, which would be considered well managed. The American Association of Clinical Endocrinologists encourages lower goals, as you can see on this slide. Although recommendations, again, should be individualized based on your age, other health issues, duration of diabetes. I always say, because I think this is so important, that there's no good or bad numbers. It's just information that will help you figure out what is going on and to help you make adjustments to keep your blood glucose within a healthy range most of the time. Okay. Think of testing your blood glucose as doing little experiments and then learn from those little experiments going forward. Okay. So the approaches to spike management include medical approaches and lifestyle approaches. I'm going to focus on the lifestyle approaches, and Dr. Gillis Funderburk will focus on the medical approaches after. The lifestyle approaches that I'm going to talk about tonight include meal planning, physical activity, stress management, and sleep. People often think that food is the only cause of high blood glucose, but actually there are many factors that can affect blood glucose levels. The Diatribe website actually lists 42 factors that affect blood glucose, which is why it can occasionally be puzzling to figure out why your blood glucose is not as you thought it might. As a registered dietitian, I have the most to say about food, so let's start here. I'm going to discuss with you strategies to help manage your blood sugar. Some of them you may have heard before, some may be new, I'm hoping that we'll try some of them out and that they will help you to improve your A1C and your diabetes management. Let's start with just a little nutrition basics. So the strategies that we discuss will be more understandable for you. So there are three main nutrients in food: carbohydrate, protein, and fat. They provide fuel for your body. And most foods contain a combination of these nutrients. There is good reason why we often focus on carbs when we talk about diabetes management. It is true that carbs have the greatest effect on your blood glucose levels, as this graph shows. The purple dots, which represent the carbs, let me see if I can get my little pointer going here. Okay. So these purple dots, that's representing the carbs. Okay. And you can see that it has the greatest effect on your blood glucose, right? Jumps way up and then falls down. Okay. So the purple dots really are showing that spike. You can see that there is much less of a rise in blood glucose after eating protein, which is represented by these teal dashes right here. Okay. And even less of a spike with fat, which is represented by this solid pink line. Let's talk a little bit more about carbs. Many foods that contain carbs are healthy foods and provide your body with many important nutrients. Carbs include your grains, such as bread, cereals, rice, and pasta, starchy vegetables, such as potatoes, corn, and peas, the legumes, which would be your dried beans and lentils. These are known as the complex carbs. Some foods contain natural sugars, such as fruits, juice, and dairy products, such as milk and yogurt. And then, of course, there are the sweets or simple carbohydrates, which includes foods with added sugars. Examples would be cake, cookies, candy, and soda. But once carbs are digested, they're all broken down into sugars. This slide provides a good visual of what happens when you eat, because I think this is important just to understand some of the other recommendations that we're going to discuss. So basically what this is showing is, when you chew, you swallow the food goes down your esophagus and into your stomach, where it's digested into smaller nutrients. The carbs are broken down into the form of sugar called glucose, which is represented by the blue dots right there in the stomach. The glucose goes down into your intestines next, where it is absorbed into your bloodstream. Then the pancreas, this organ, this weird shaped organ here, that sits behind the stomach, releases the hormone insulin, which is represented by those yellow dots. The insulin assists in transferring the glucose from the blood to the cells of your body to give you energy. Think of insulin as the key that unlocks the door to your cells to let the glucose in. When people develop diabetes, their pancreas is either not making enough insulin, or their body produces, or the body does not respond to the insulin that they are making properly. So either you're not producing enough or you're not responding to the insulin properly. Okay, so the glucose stays higher in the blood. So how can we reduce the spike that carb foods tend to cause? There's actually several ways, and that's what we'll talk about next. Okay, you've likely learned when choosing your carb foods, it's best to pick foods that are less processed. Foods that are less processed are higher in fiber, and so they're digested more slowly than highly processed foods. Therefore, you won't get that high blood glucose spike as much as when you eat processed or refined foods. For example, whole grain bread won't raise blood glucose as much as white bread. Another example would be old-fashioned or steel-cut oats won't raise your blood glucose as much as instant oatmeal. And this is because the starch molecules that are in whole foods take longer to break down. Basically, starch is a chain of glucose molecules which are bound together. It's what forms carbs. Okay, so a little bit of the science I think is always interesting first, because what I wanted to talk about is a little bit about resistant starch. Okay, and if there are any science buffs out there, you may enjoy this. Just wondering if anyone's heard of the term resistant starch. As its name implies, it resists digestion. It's a less digestible starch. Okay, and I thought this side-by-side comparison made it more understandable. Most starches, we'll call them the regular starches, are broken down by enzymes in our small intestine into sugar. Then they are absorbed into the blood, which causes your blood glucose to rise rapidly. Interesting though, we can't fully absorb all kinds of starch. Some starch, which is known as the resistant starch, isn't fully absorbed in the small intestine. Instead, it passes through the body without being digested until it reaches the large intestine, or your colon. And there it acts like fiber and feeds the good bacteria in the body. So therefore, there's not a significant blood sugar spike. Resistant starch is similar to fiber in that it improves the body's responsiveness also to insulin, and it's also been shown to provide less calories to the body when it's in the resistant form. Okay, sounds pretty good, right? But where can you find this resistant starch? Well, some of it you can already find in your home. It's naturally found in your legumes, your beans, lentils, and dry peas, whole grains like oats, brown rice, barley, starchy vegetables like corn and sweet potatoes. But there's another way of increasing resistant starch. Okay, I thought this was really interesting to know that cooking and then chilling certain starchy foods, such as potatoes, rice, and pasta, also increases their resistant starch content. When starch is heated, those starch granules or molecules in the food will swell during a process that's called gelatinization. But when that same food is then cooled, some of that gelatinized starch gets converted to the less digestible or resistant type of starch. Okay, so let's talk about some examples. Potato salad would not raise blood glucose as much as a hot potato. Okay, and also just keep in mind that mashed potatoes tend to raise blood glucose more than like a baked or roasted potatoes. Okay, so basically taking the hot food like the potato and then chilling it in the refrigerator makes it a more resistant starch. Same with rice. Once it's cooled, it becomes a more resistant starch. So you might try adding cold rice or quinoa to your salads for that resistant starch. Pasta is another good example. Cold pasta, such as in pasta salad, contains the more resistant starch and shouldn't make your blood glucose rise as high. Or another good tip is to try cooking pasta, potatoes, rice, or other whole grains a day or so in advance, then cool it in the refrigerator overnight, and you can eat it either cold the next day, such as in pasta salad or potato salad, or you can reheat them before eating. Reheating doesn't reduce the quantity of resistant starch. And that part I found very interesting because I knew about eating it cold didn't raise blood sugar as much, but there was a study, there was a small study done several years ago that I thought was very interesting. They took a group of 10 volunteers and they tested them over a 3-day period after eating a bowl of white pasta topped with a simple tomato sauce. Okay, and on day 1, they ate the pasta hot. And then on day 2, they ate the pasta cold. And then on day 3, they ate the pasta that was chilled and then reheated. Okay. And then after eating each bowl of pasta, the participants checked their blood glucose every 15 minutes for 2 hours. And the samples were analyzed to find out how much glucose they had in their blood and plotted how their blood glucose levels changed as the meal was digested. And this is what the results showed. When they ate the fresh cooked hot pasta, blood glucose showed a sharp rise and fall, which was expected. When they ate the chilled pasta, blood glucose did not rise as much. And when they ate the reheated pasta, blood glucose rose half as much as it did after eating even the chilled pasta. And this really surprised, the research team because this was never really tried before. I mean, this was a small study. Remember, there was only 10 people. So I invite you to try this on your own. Again, one of the reasons why I really encourage people to test their blood sugars in pairs is because you can really get some hopefully helpful information. So you might want to do this little experiment on your own, or experiment with maybe cooking pasta ahead of time or other starches and then reheating them. And I'm always trying to get people to do more meal prep. And when I talk about meal prep, it's just ways to make your life easier when it's time to prepare a meal. And oftentimes at dinner time, it's late, we're tired, especially after a day of work. So sometimes having parts of the meal done prior can be really helpful. And I think that might be a real good use for doing this, is to maybe the night before cook your pasta and put it in the refrigerator and chill it, and then you can just reheat it the next day. And try that with some other grains too and see if you get similar effects. And since we're talking about pasta, another tip is not to overcook your pasta. Cooking it al dente, or the lower amount of time that's specified on the package, tends to, it doesn't release its starch molecules as quickly, so blood sugar levels tend to be less. The rise in blood sugar is less when you cook your pasta al dente. Okay, when it's overcooked, it just kind of, the starches loses their form and it gives up the glucose more readily, and then they have a higher blood glucose level. Okay. So now we talked a little bit about the fiber and the resistant starch. Next, real important, is talking about carb quantity. That's the next strategy. And I really want people that have diabetes to know that it's fine to eat carbohydrates. It really is just all about getting the right balance. For many people, cutting out carbs can lead to cravings, binges, insulin resistance, and just an increased anxiety around food and social events. And we certainly don't need any extra stress or anxiety in our lives. But keep in mind that the total amount of carbs that you eat really has the greatest impact on your blood glucose level. The more carbs you eat at one time, right, the more likely your blood glucose will go up, showing this, large plate of pasta. So what can we do, right? What can we do to help that our blood glucose won't go up so much when we eat our carbs, okay? Because we don't want you to eliminate them. Okay, so when we eat carbs by themselves, they quickly go to your stomach where they're digested into sugar and quickly raise your blood glucose. However, what you eat with the carbs can reduce the effect that they have on your blood glucose. So let's talk about this strategy. Okay, we can prevent these spikes in blood sugar by pairing foods together. Okay, so protein, fat, and fiber require a little more work to be broken down than carbohydrates do. This means these foods stay in our stomach longer and take more time to enter the bloodstream. So pairing your carbohydrate foods with a source of protein or fat and some fiber helps slow down the absorption of the sugars into your bloodstream. And this helps us maintain that more steady blood sugar levels throughout the day. And it can also make you feel full longer and increase your satisfaction after a meal. This way you can still eat the foods you enjoy, just try pairing them up. So protein foods to include would be things like chicken, fish, beef, pork, eggs, cheese, beans, hummus, tofu, and other plant-based proteins like nuts, nut butters, peanut butter. Healthy fats include nuts, avocado, olive oil. Fiber is found in your vegetables, fruits, whole grains, also in nuts and beans and seeds, such as flax seeds, chia seeds, and hemp seeds. So think of ways to add those, throughout your meals too. We can talk about some. Okay, so here are just some examples of pairing carbs with protein and fiber, also just known, right, as a balanced meal or the plate method. Aim for some carbohydrate, some protein, fiber, foods, and healthy fat. So next I wanted to talk a little bit about snacks, because for snacks, it's still recommended to pair your carb foods with protein. It will keep your blood sugar more steady. Often when we go for snacks, we grab quick and easy foods, which are often high in carbs, such as pretzels, chips, crackers, cookies, things like that. When we eat these carbs alone, it's easy to eat a large amount of them, right? And they don't keep you feeling full for very long. Carbs digest very quickly. So you soon get hungry and then you're looking for the carbs again. And this type of eating tends to make your blood glucose go up and down, right? Like the roller coaster. So try pairing your carb foods with protein. You'll likely eat less of the carb foods at one sitting when you pair it with protein, and your blood glucose will also stay more steady and you won't be hungry as soon. So this list shows some proteins, again, to pair your carbs with. Again, the nuts and peanut butter, hard-boiled eggs, I find it very convenient to keep around. Cheese, especially cheese sticks, I find cheese that comes individually packaged can be really convenient. Same with the cottage cheese. They even come in the little containers, which are great for portions. Sliced meat, hummus, Greek yogurt, and then you can pair them with your other carb snacks. And this graph just shows too that when you eat carbs by themselves, right, blood sugar jumps up and then falls, right? And then you're going to get hungry again, and have more carbs and so on. But if you pair your carbs with some protein, it's not going to be as high of a peak, and it's going to keep you feeling full longer. Okay. So it's a flatter curve, strike the spike. All right, let's look at some examples of carb and protein pairings. And you can mix and match these any way you want, but I just wanted to show you lots of different examples, and they can probably be, mixed and matched with each other. But I was just showing how, right, whole grain crackers can be paired with a hard-boiled egg, maybe graham crackers and some peanut butter. Okay. Tortilla chips, whole grain bread and turkey slices, might be one pairing. And I like to call these, they can be either snacks or even mini meals, especially if there's a long time between meals. I think it's important to plan to have a snack in between. And these pairings are often, great choices. Tortilla chips and cheese cubes or cheese slices, or melt some shredded cheese on top of your tortilla chips in the microwave. Okay. And I was going to say, when you pair your carbs with protein, it's easier to have a smaller amount of the carbs. And eating a smaller amount of the carbs will improve your blood glucose, right? I'm sure a lot of you know what I mean. Like if you were to take the bag of tortilla chips and just eat that, you're more likely to eat the whole bag of chips as opposed to if you had it with a little bit of protein. Fruit and cottage cheese or ricotta cheese or string cheese are great combinations to do too. Okay. Fruit and nuts or peanut butter are also great combinations. Pistachios take longer to eat because you have to take them out of the shells, so sometimes that just helps to slow it down. Pecan halves, almonds, and walnuts are also very healthy snacks. And don't forget about vegetables, raw vegetables. I like to have raw peppers and tortilla chips with dip. I find sometimes that helps too. I'll eat less of the tortilla chips because I have the vegetables with it, but you still get some crunch. Hummus or black bean dip are great choices. They have a lot of fiber and healthy fats. Berries with walnuts are both loaded with antioxidants and help decrease inflammation in the body, so that's always a good go-to snack. Waffles and peanut butter is great for breakfast or for a snack. Pairing those carbs and protein is really the key. Here was another pairing. This is a long one. I just put together, yogurts, preferably Greek yogurt. It has more protein because if you combine that with sliced almonds, berries, and a sprinkling of granola, that could be a really delicious snack instead of some other sweet treats. Guacamole is a great dip because avocados contain healthy fats. And guac and hummus are both great with pita chips, tortilla chips, and vegetables. Mm. And while we're talking about the pairings, I wanted to just talk a little bit about other balanced meal combinations. And I've really been into bowls lately. I was calling them here balanced bowls. Some people call it veggie bowls, grain bowls, Buddha bowls, but they're a great way to combine your grains with your veggies and protein and healthy fats. And again, just lots of different options and combinations that you can come up with. So here I just did a slide on how to build a balanced bowl. Basically combine your leftover vegetables, grains, and protein in a bowl. I do this a lot to bring for lunch. I find it's just really convenient use of leftovers. But if you just combine those different components and you add a vinaigrette dressing or just a teaspoon of oil and a little drizzle of vinegar or lemon juice, you can add nuts and avocado for more healthy fats. Adding a handful of greens really has been one of the easiest ways for me to add more vegetables to my day. I just buy the bags or containers of baby spinach, arugula, spring mix, kale. Just remember, you have to massage your kale. If you put the kale in a bowl and you add a little bit of olive oil and just with your hands massage it and let it sit for a while, it really tenderizes it. It makes it so much better. I didn't like kale before doing that, or making kale chips is a great use of kale as well. But those are some tips for building some balanced bowls. And I often, even for work, just take a container with a lid. And I'll just put in a handful of greens and other vegetables that I have on hand. You can throw in grape tomatoes because they don't require much work, canned beans, nuts, again, the leftover vegetables, leftover protein if you have it, like chicken or fish. But if you don't have leftover protein, you can either add canned tuna, even canned chicken, hard-boiled eggs, definitely beans, things like that would be great to keep on hand. And so I figured we might as well talk a little bit about breakfast bowls, because I thought these were just some really easy breakfast bowl ideas. And as I always say, breakfast foods can be eaten any time of the day. So when you don't have time or energy to make a traditional dinner, make breakfast for dinner. But the first pick is of Greek yogurt and berry bowls. So if you just combine Greek yogurt, berries, almonds, if it's the plain Greek yogurt, a little touch or drizzle of honey would be fine. And you can even make those a day ahead as well. The second picture is cottage cheese bowls. And if you just top cottage cheese with berries, or this one they did it with diced apple, I thought that looked interesting too. They sprinkled a little bit of nuts, like pecans or walnuts would be good with the diced apple. And again, a drizzle of honey or maple syrup or cinnamon to the apple bowl would be great too. And if you don't like cottage cheese, although try it again, I think prepared in different ways, you might find you actually enjoy it. Ricotta cheese could be used in place of cottage cheese as well. Some people like the texture of that better. And then another way to get more resistant starch that we were talking about before is to make overnight oats instead of cooked oatmeal. If you just soak the uncooked oats in milk or a non-dairy milk or yogurt, then refrigerate it overnight. And you could add many other ingredients to them to make them more tasty. I recommend adding some chia seeds too for more fiber and healthy fats and to make it more creamy, but you can add berries and different flavorings to your overnight oats as well. And quick breakfast for the morning. Just refrigerate it overnight. And just some more breakfast pairings, because I really like the pairing approach. So again, just pair up either your bread, waffles, cereal, English muffins, oatmeal with your different proteins, your cottage cheese or ricotta cheese or Greek yogurt, eggs, nuts, peanut butter. So aim for lots of different combinations. And the plate method for meal planning has long been my favorite meal planning tool. It's a good model for managing blood sugars as well as in many other health, just for good health. But it helps balance the carbs with the protein and the fiber in the vegetables. I wanted to teach you or show you another strategy if you weren't aware of this one. It might really help to decrease your blood glucose or post-meal spikes. There are studies that show when people with type 2 diabetes eat the protein and the vegetables before they consume the carbohydrate at the meal, they had a significantly lower increase in their blood glucose after the meal compared to when they ate the carbs first. When people ate the carbs last, their post-meal or after meal blood glucose levels were about half as high as when they ate the carbs first, and about 40% lower when they ate all components of the meal together. So that can be a helpful tool for some people too. And just to explain, why. The reason for this is a hormone that is secreted when we eat. So it's called GLP1. And GLP1 stands for glucagon-like peptide 1. And when we eat, our small intestine secretes this hormone in response to nutrients. And this hormone has several functions that help to lower the sugar level in your blood. It stimulates the pancreas to secrete more insulin. It inhibits your liver from releasing stored glucagon, or that's the storage form of glucose, into the bloodstream. Okay. It also just helps you to feel fuller after a meal. It's been shown to slow gastric emptying. So that's another way it decreases the sugar into your blood. So that's the overall goal, or the overall function of this GLP, is it does tend to lower your blood glucose level. Okay, so the reason why it helps to eat the protein first is, as you know, protein, right? We discussed protein does not significantly raise your blood glucose levels in the way that carbohydrates do. And since GLP is secreted in the presence of nutrients, any nutrients, protein or carbohydrate, research hypothesized that consuming the protein before the carbohydrate containing meal, it helps stimulate the release of this hormone, GLP, and therefore lead to insulin release prior to the carbohydrates entering the body. So basically, I like to think of it as so the insulin is ready and waiting when the carbs are digested, when it's needed. So that can really help produce or reduce blood glucose spikes. And the effect is thought to be similar to that of GLP receptor agonist medications, which I'm sure Dr. Gillis Funderburk will talk about, because there's a whole bunch of those medications you probably hear all the time on commercials for Rybelsus, and then there's Ozempic, Trulicity, Victoza, Byetta, all those medications. So this is a way that you might be able to, eat the protein first, and it might have similar effects. Next, we'll talk about solids versus liquids. Juice will raise blood glucose more than the whole fruit, since it's very processed and does not contain the fiber that is in the whole fruit. So a whole fruit is a better choice. Liquids tend to be the worst for blood glucose. They really just raise blood glucose very, very quickly. So drinks with out sugar would be best choices. Water, best choice. You can add fruit if you'd like, or different flavorings. Seltzer or sparkling water are great too. Coffee, tea, as long as you're not adding a lot of regular sweeteners to it. So ideally choose unsweetened beverages. Let's just switch. Okay, that was food. We'll talk a little bit about physical activity. Physical activity after eating can reduce post-meal blood glucose spikes. Basically, muscle activity diverts blood flow away from the intestines, resulting in slower absorption of glucose into the blood. Also, glucose entering the bloodstream is likely to be used by those working muscles rather than stored for later use. How much activity is required to get these benefits? Not very much. Even 10 to 15 minutes of mild activity will be beneficial. Of course, more is great too. But several studies suggest that timing your walk about 30 minutes after eating may provide the most bang for your buck as far as lowering your blood glucose. So even taking short walks after dinner, really had a great effects on blood glucose. Especially they found in some studies when the meal had lots of carbohydrates, going for a walk after meals decreased the blood glucose level, much more so than if you were sedentary. So movement, even 10 minutes after 3 meals, after your three times a day can be great. After lunch, dinner, or any meal, try to get in a little walking. It might really help lower those blood glucose spikes. And, schedule your active tasks like housework, yard work, shopping, walking pets for after meals. Go for a walk, or do some chores, shoot some hoops, whatever it is to get you moving. Also, attempt to schedule your exercise sessions for after meals. Go out dancing. Make it fun, things that you enjoy. Every step counts. Take a walk after lunch or dinner, walk around while talking on the phone. I like to do that. March or stand or stretch while watching TV. You can just really, for 10, 15 minutes after meals while you're watching your show, just march, walk side by side. There's a lot of good videos that you can watch too, with some walking at home videos. So let's just talk a little bit about sleep. Too little or poor sleep can disrupt your hormones, which leads to increased appetite and higher blood glucose levels. When we don't sleep enough, we tend to snack more and often reach for carbs or sweets later in the day, and often do not make the best decisions about exercise or food choices. So here are just some sleep hygiene tips to help get you a better night's sleep. Main thing is to be consistent. Just like with meals, we should be consistent with bedtime and wake up times. Turn off the TV, computer, and phone. Avoid those large meals close to bedtime. Caffeine and alcohol close to bedtime also disrupt sleep. Keep your bedroom quiet, dark, and relaxing, and aim for 7 to 9 hours per night. Just really find a sleep routine that works best for you. And if you do have trouble sleeping, discuss that with your healthcare provider. It may be something that needs to be treated, like sleep apnea. Stress management. This is sometimes a difficult one. It's easier said than done, but stressful situations can make your body think it's under attack, and it causes your body to secrete certain hormones such as cortisol and adrenaline to prep itself for a fight or flight response. And these hormones cause a flood of stored glucose to be released from the liver into the bloodstream, which can raise blood glucose levels. So what can you do? Try to recognize that there's different stress triggers in your life and work, and try to limit your response to them, or practice different relaxation techniques, breathing techniques. I do a lot of deep breathing, meditation. Physical activity is helpful. Find a healthy stress buster, something that you enjoy. And if you find that stress is very, very difficult, consider seeing a counselor or therapist to help you through it. It's been a tough couple of years. And if you currently monitor your blood glucose, note how your food choices, activity, stress, and sleep affect your blood glucose. Look for those patterns and trends. And remember, no good or bad numbers. It's only information to help you manage your blood glucose better going forward. And then you make adjustments and see what happens. So to sum up, aim to plan balanced meals and snacks, find enjoyable ways to move, manage stress, and practice sleep hygiene. And I just want to stress, don't feel like you have to implement all the strategies that we talked about immediately. That may seem overwhelming. And when we're overwhelmed and stressed, we don't tend to stick with our changes. So focus on 1 or 2 items at a time. I really want you to focus on small, doable changes that you can make, and then keep adding on. And get support from friends and family that are helpful and not negative, or try to sabotage your efforts. And if that's not available, we have you covered here at Capitol Health too. Just check out the community events calendar of the programs we offer. I do a monthly Speak with the Dietitian class on Zoom, and our nurse diabetes educator, Laura Moran, who's awesome, does several groups as well. She has a group for newly diagnosed people with diabetes, a Speak with the Diabetes educator class, and a diabetes support group. So take advantage of these programs. And with all that said, I guess we're going to wait, and I'd be happy to answer your questions at the end of the program.
Thank you, Mindy.
You're welcome.
Next is Dr. Funderburk.
Okay, so hopefully everyone can see that. Thank you, Mindy, for that talk. I always learn something new every time we do these talks together. Again, my name is Dr. Gillis Funderburk, and I am the medical director for the diabetes education program here at Capitol Health. And I'm going to also talk about managing diabetes, briefly talking about the lifestyle changes, but focusing my talk more so on medications. Just giving a brief overview of the types of diabetes, talking about the pillars of managing diabetes, and then again, going into a discussion regarding the medications we use to treat diabetes, looking at oral medications, non-insulin injectable medications, and then also insulin. So there are 2 main categories of diabetes. We're going to mainly be focusing on type 2 diabetes, but again, we are going to be talking about insulin. So that's going to be pertaining to type 1 as well. But there are 2 main categories. There's type 1 diabetes, which are basically people who do not produce any insulin. And so they absolutely need to have insulin in order to sustain life because their pancreas does not produce insulin. These are people that are usually diagnosed as children or young adults, whereas type 2 diabetes is the most common form of diabetes and is often diagnosed in adulthood. Although with obesity occurring more frequently in children, we are seeing a higher rate of diabetes being diagnosed in children as well. People are typically overweight, and it's marked by, marked by insulin resistance, that can progress to also having a decreased insulin production. So I love this slide. Mindy and I do quite a few talks together. And so she uses this slide and I like the slide as well. But again, just going through the normal glucose regulation. So as Mindy said, you basically eat food, food that has carbohydrates in them, are going to be, all food is going to be digested starting in the stomach, but specifically we're talking about carbohydrates. So carbohydrates get into the stomach, then there's enzymes that release that break down the carbohydrates into glucose. Then when it passes into the intestines, that glucose is then absorbed into the bloodstream. Again, that's the blue little circles here. And then at the same time, the insulin releases pancreas into the bloodstream. And then that's where the glucose and insulin then get to the cells that need it and have their action. So when we talk about type 1 diabetes, this is healthy. So again, you have the pancreas releasing insulin. There's glucose that's in the bloodstream as well. The insulin binds to this receptor and then allows the glucose to get into the cells. For people who have type 1 diabetes, there's no insulin being released from the pancreas. So you see there's no blue dot here. So basically there's nothing to bind to this receptor, so the glucose cannot get into the cell. So this is why it's a problem if someone with type 1 diabetes does not get their insulin, it can be fatal. Type 2 diabetes, again, in the beginning, what actually is occurring is that there's not a problem with insulin production from the pancreas. There's an issue with insulin resistance. So as you can see here, there's plenty of insulin compared to the normal situation. But what's happening is that at the receptor here, the receptor is resistant to the insulin. And so even though there's insulin there, it's not allowing the channel for the glucose to open. And so glucose just stays outside of the cells. And that's what caused it to be elevated in the blood. So how do we manage? As Mindy just discussed, there's multiple ways that we can manage diabetes. One of the most important, or the most important, actually, I should say, our lifestyle for people with type 2 diabetes. Again, with type 1, people absolutely have to have insulin. There's no way around it. With type 2 diabetes, though, they're even though these are important for everyone, for type 2 diabetes, they can definitely change the way diabetes is managed as far as how many medications someone may require. So weight loss, eating healthy, regular physical activities are pillars of managing type 2 diabetes. And again, it's very important for type 1 diabetes as well. Like someone with type 1 diabetes, you don't want them eating cake or cookies, but even when they're eating a very healthy diet, if they don't have insulin there, it's not going to control their sugar. So again, weight loss, eating healthy, regular physical activity are very, very important when we're managing diabetes, and medications are also a tool that we have in our toolbox to help manage as well when these other forms of management are not keeping the sugars under control. So I just want to also talk about some like little tricks as far as managing diabetes that Mindy mentioned in her talk as well. But besides, again, talking about specifically how much carbs you eat, what types of carbs that you eat, what medications you're taking, or just little tricks that you can use to help lower your sugar. I think Mindy talked about just drinking water before you eat. So drinking 1 to 2 glasses of water prior to eating has been shown to, 1, reduce how much people eat, and then 2, reduce the postprandial or post-meal spikes that sometimes occur after eating. Again, walking that 10 to 15 minutes after eating can very much be helpful in reducing the postprandial spikes that sometimes are causing your A1C to be elevated. Again, Mindy mentioned that eating the protein and the vegetables before your carbohydrates, that this, again, is another way to lower that post-meal spike. And then also can help reduce insulin levels, which is often seen. So in addition to the glucose being high, the insulin, in order to try to bring the glucose down, is also high. And then that can in turn cause people to feel hungry and just want to eat more after they've, had a meal. One of the things I did want to talk about that I'm not sure if, I don't think Mindy mentioned this one, but just sometimes people will have a great glucose or sugar when they go to bed. Their sugar's 120 when they go to bed, but then when they wake up, they find that their sugar is 50, 60 points above and can't figure out why, just because of the fact that, they went to bed normal and then they're waking up higher. And that's something called dawn phenomenon. And sometimes having a high protein, low fat snack before bed may help to stabilize those sugars so that it doesn't rise overnight. So if you're someone that has that issue that the sugar is high in the morning, but fine the rest of the day, you may have dawn phenomenon. And so a high protein, low fat snack might be helpful. Sometimes there might be something like sleep apnea that's also causing the sugars to rise as well. So medications. So again, I'm going to talk about oral medications, non-insulin injectable medications, and then insulin. So there's actually just basically 7 classes of medications that we have to treat diabetes. And each of these classes can have between 1 to 3, 4 manufacturers that make the medications in that class. So we're going to deal with them as a class. Within each class, there are some nuances that one medication might be have a little bit of different side effect profile, be a little bit better, but overall they're similar. So we're going to talk about these medications individually and the way, and then these are non-insulin injectable, and the way that we'll break down each medication is to talk about how they work, how do we take them, what are some of the contraindications or cautions of these medications when you may say that, okay, this is not the right medication for a particular person? What are the side effects, the most common side effects of these medications? Risk of hypoglycemia, which is always something that we're concerned about anytime we start a new medication. Preferably want to use medications that are not going to increase the risk of hypoglycemia. And some medications have secondary benefits. So in addition to actually lowering the glucose, some may help with weight loss, may help with reducing cardiovascular disease or protect the kidneys. We'll talk about which medications will give those additional benefits. Cost is always an issue. We can have a great conversation in the office as far as, this medication is, a great option. And then we get to the point where it's just not affordable. So talking about cost of medications, and then importantly, what is the reduction in the A1C that we see with these medications? And that part I'm going to actually save to the end. This is basically an overview of everything that I'm going to discuss today. So it basically tells us, okay, where do these medications act as far as having an effect? And so we have that they work in the pancreas. So with the pancreas, they're going to increase insulin release. They may work in the brain as far as decreasing appetite. They may work in the kidneys, reducing or increasing how much glucose gets spilled into the urine versus getting reabsorbed into the bloodstream. They may work in the muscle, which basically is increasing the uptake of glucose into the cell, so we're getting it out of the blood. Some work on fat cells and decrease how much triglycerides, which increase insulin resistance in the body. Others may work in the liver, where they decrease how much sugar the liver puts out. And then some may decrease in the intestines, how much glucose gets absorbed. So this is the way that the medications work. And some work in multiple areas, and some work in just one particular area. So metformin, I'm sure everyone has heard of metformin. It is ubiquitous. We use metformin basically as first line now, and all of that may be changing based on the newest guidelines that may not necessarily be a first line medication anymore. But just to go to the end, it's very inexpensive. I'm not sure if ShopRite still does it, but at one point ShopRite did metformin for free. So metformin's been around for a very long time. It's the only medication in its class It's an oral medication. Some people take it before breakfast and dinner. Some people maybe just take it before dinner. And sometimes we actually use it at bedtime. And that's typically for people who have that dawn phenomenon. It is associated with a small amount of weight loss. You don't get hypoglycemia. And when I talk about the medications, a couple things before I continue is that I'm talking about the medication when they're used just by themselves. If these medications are used in combination with insulin or one of the medications that does cause hypoglycemia, if you use them in combination, then they always can be associated with hypoglycemia as well, but they're not in particular causing the hypoglycemia. So metformin does not cause hypoglycemia. So we use metformin in people who don't even have diabetes. And again, it doesn't cause hypoglycemia, which is low glucose. Side effects of the medication are lactic acidosis. So before metformin, there was a medication called fenformin that was taken off of the market because of the lactic acidosis. Metformin has that warning as well. But over the years, the research has shown that it's less likely to get lactic acidosis in lower and lower levels of kidney problems, which is generally what it's associated with. So if someone has heart failure or has kidney failure, typically what happens is that the medication does not get metabolized and excreted from the body as well. And when that happens, you can get a buildup of lactic acid. And so originally when metformin was put on the market and had warnings, the level that we allowed for kidney problems was at a higher level than it's currently at. We now know that we can use metformin in much lower levels of kidney function and it'll still be effective. It can definitely be associated with gastrointestinal symptoms is the most common. So people who often discontinue the medication is because of diarrhea is the most common. And the metformin has been shown to be associated with B12 deficiency. So it is recommended if you're taking metformin that you should get your B12 levels checked at least annually to make sure that there's not a B12 deficiency that's developed from metformin. B12 deficiency can cause numbness and tingling in extremities that sometimes may be blamed on neuropathy and actually could be related to a B12 deficiency. So again, there's precautions if you do have kidney, liver disease, and then heart failure. I often get asked, does it cause kidney problems? And the answer is no. So metformin doesn't cause kidney problems, but if your kidneys are not filtering the metformin or metabolizing the metformin effectively, then the metformin can build up in the system and cause that lactic acidosis. And again, metformin is very inexpensive. Metformin works by decreasing the liver's production of sugar. It works by decreasing glucose absorption in the intestines, and it improves the uptake of glucose into the muscle. So metformin is working 3 different ways to actually lower glucose levels. Sulfonylureas are a old medication. That's actually the oldest medications that we have available for treating type 2 diabetes. And they basically increase insulin secretion by the pancreas. So that's the only way that it acts. It just increases release of insulin from the pancreas. It's taken orally before meals. Because it's releasing insulin, it can cause hypoglycemia. And I should say because it releases insulin and doesn't act in any other way in the body, it can cause hypoglycemia. Otherwise, sulfonylureas are generally well tolerated. We do have to take precaution, however, if someone has kidney disease, because the medication, again, can stay around in the system for a prolonged period of time and cause the sugar to drop. They also are associated with weight gain. And so when we're talking about type 2 diabetes, a lot of times, again, they're is an association with being overweight or obese with insulin resistance. And so the last thing we would want to do with the medication is cause weight gain. So this is not something that we typically are going to use first, second, or even third line, just because we want to avoid medications that cause hypoglycemia. We want to avoid medications that cause weight gain. And now we know we also want to avoid medications that just make our pancreas release more insulin. Because as we saw in those earlier slides, we already have plenty of insulin production. We just want to sensitize the body to the insulin that's already being produced and released. And then there is an association with this class of medication with increasing cardiovascular risk. It is generic. They've been around for a very long time, so they are very inexpensive. I do use these medications, so it's not something that's not used, but again, we're going to see if we have alternatives to use before we often will use sulfonylurea. So the next class of medications are very similar to sulfonylureas. They're called glinides. There's just two in this class, repaglinide and nataglinide, or Prandin and Starlix. And they do the exact same things as sulfonylureas do. They increase insulin secretion by the pancreas. The thing that's better about these medications than the sulfonylureas are they're shorter acting, and they also can be used in kidney disease and kidney failure. So we actually can use these even with patients who are on hemodialysis. They are taken orally. They're generally taken before each meal, so taken 3 times a day. Again, they can cause hypoglycemia. They're generally well tolerated. They can, just like sulfonylureas, cause weight gain, and they may increase cardiovascular risk. These are available in generic forms, so they are also inexpensive. So the next class of medications are glitazones. So Actos and Avandia are in this class of medication, and so they are oral medications. They're taken with meals. We avoid them if someone has a history of heart failure. Rosiglitazone, which is the Avandia, may also increase risk of bladder cancer. So that one is really not used at all anymore. Actos is still used, but actually very sparingly because of its association with weight gain, water retention, and heart failure. There was no risk of hypoglycemia, or there is no risk of hypoglycemia with this class of medication, and they are available in generic form. And so they're relatively inexpensive. So the glitazones work by a couple of mechanisms. They increase the muscle uptake of glucose and also decrease the liver's production of glucose. So in that way, again, they're working without increasing insulin release. And so they're just an insulin sensitizer. So in that way, they're actually like great medications, but again, because of the fluid retention, weight gain, and potentially heart failure in certain populations, we just don't use them that often anymore. So a newer class of medication, and when I say newer, it's still been out for like over 10 years, or what's called DPP4 inhibitors. These are oral medications. The medications in the class are Januvia, Onglyza, Tradjenta, and Alogliptin. They are oral. We have caution if someone has a history of pancreatitis or if there's kidney failure. 3 of the 4 of these do need to be adjusted if someone has kidney failure. If there is kidney problems, Tradjenta may be the one preference, because that one you do not have to adjust based on kidney function. They're weight neutral, so they don't cause weight loss or weight gain. They're generally well tolerated. The most common side effects are things like upper respiratory symptoms, maybe some diarrhea, and then a rare side effect are severe joint aches. They do not cause hypoglycemia because they are branded, except for the Alogliptin, that is a generic, but it still can be expensive. They are on the expensive side. So the way that DPP4 inhibitors work is, Mindy had mentioned the GLP1 in her talk. And so GLP1 basically increases the pancreas release of insulin, and which is going to help reduce glucose. And then it also decreases glucagon production. So it decreases the liver's production of glucose. And so basically what DPP4 inhibitors do is they inhibit the breakdown of the GLP to inactive peptides. So they make more of the GLP1, and then that basically amplifies the effect of insulin release when you eat food, so that improves the glucose control, as well as decreasing the liver's production of glucose by decreasing glucagon released from the pancreas. So GLP1 agonists, these are like definitely one of the favorite medications that we have now, just because how effective they can be in lowering the glucose. And then also they have some secondary benefits. So basically these medications are Byetta, Bydureon, Victoza, Trulicity, and Ozempic. Those are all the injectable versions. And then oral is Rybelsus. So the ones that are just weekly are the Bydureon, Trulicity, and Ozempic, and then Byetta is twice a day, and Victoza is once a day. And so basically these medications, the weekly ones and the daily ones, we take it before the first meal of the day, and Byetta is generally taken before breakfast and before dinner. So contraindications for these medications are a personal or family history of a rare type of thyroid cancer called medullary thyroid cancer. It's extremely rare, but there are some familial disorders, and sometimes they happen sporadically that are associated with medullary thyroid cancer. So if someone has a personal history or a family history, we would not use these medications. Also, if someone has a history of pancreatitis, it would be something that you would likely not recommend. It's not an absolute contraindication, but often we would probably not use the medication. The most common reason why people will stop these medications are related to a GI upset or gastrointestinal upset. And we'll talk about the reason why these symptoms occur when we go through the mechanism of how they work. So nausea, vomiting, diarrhea, or constipation, heartburn, just dyspepsia or upset stomach are the most common side effects. Again, these medications have secondary benefits with weight loss, and they have cardiovascular as well as kidney protection. If they're used alone, there's no hypoglycemia. They are very expensive. They're all branded medications, and they are probably the most expensive of the diabetes medications that we have. So how do these medications work? We went back before as far as seeing how GLP1 is increased with the DPP4 inhibitors. What do specifically GLP1 do besides decreasing the glucagon and insulin production in the pancreas, which helps with improving glucose? So the main mechanism as far as helping with weight loss is in the stomach. So it delays how quickly your stomach empties. So the food sits in the stomach longer and people have a feeling of fullness, and so they just eat less. In the brain, it also directly works by decreasing appetite. And so that helps with weight loss. And then again, because of the decrease in glucagon, there's a decreased production of glucose in the liver. And then insulin sensitivity improves. So now that same amount of insulin that was being produced is now going to, the muscle is now going to be more sensitive to that. So there's going to be improved glucose uptake and storage in the muscle and the fat cells. SGLT2 inhibitors is a newer class of medication. This is Invokana, Farxiga, and Jardiance. So these medications basically lower the set point that our kidneys spill glucose into the urine. Under normal circumstances, the glucose has to be above 180 to 200 before the kidneys will start spilling glucose into the urine. So as blood gets circulated through your kidneys to get filtered, if the sugar was 100 or 140, 160, there would be no change or no spilling of glucose or very little spilling of glucose into the urine. Well, these medications lower that set point. So now when your glucose is 160, there's going to be some spilling of glucose in the urine, and that's going to help lower the overall glucose levels in your blood. So it's a novel way. That's the way that this medication works, is strictly through the kidneys. It is oral. It's taken in the morning. Basically, this medication was shown after it came on the market that we should hold it prior to surgery because there was association with, again, a buildup of acid, something called diabetic ketoacidosis, when these medications were not held probably prior to surgery, which was probably related to decrease in a blood flow that caused basically this ketoacidosis. Also, if someone has peripheral arterial disease, you have to be careful. Again, it's probably a circulation issue that you're decreasing blood flow, and that may lead to a worsening of peripheral arterial disease. And then if someone's taking diuretics, again, because the medication works through the kidneys, and basically when you lose glucose, water goes with that. And so if someone's already on a diuretic and then you give this medication, which is also somewhat a diuretic, you can end up causing significant dehydration and kidney problems because of that. The most common side effects of these medications are increased urinary frequency. Again, it's just because of the way the medication works. You're spilling glucose. Glucose brings water with it, so people will urinate more frequently. Typically what happens is that the urinary frequency increases a significant amount when someone first starts the medication, but then after that, they're on it for a little while, they kind of settle back down, and it may be more than they're used to, but it's not as bad as when the medication is first started. Because of the increased urinary frequency, always tell people when they're starting the medication to make sure that they do stay hydrated, to make sure that they're drinking water throughout the day. Because glucose is spilling into the urine, basically bacteria and yeast that are normally growing are present in the urine and the genital system can basically overgrow. And so we do see an increased risk of urinary tract infections as well as mycotic infections, which are basically yeast infections. Yeast infections more commonly would occur in women, but they can also occur in men. And then there are occasionally, again, partially related to dehydration, that we can see changes in the kidney function or acute kidney injury. Even though that can happen, at the same time, these medications actually can be beneficial in the kidneys. So they actually now have indications to use the medications even when people don't have diabetes. So someone who just has like kidney disease, these medications actually can help reduce the deterioration in the kidney function over time. So we use the medications now outside of someone even having diabetes. And if someone does have diabetes and has kidney problems, it actually can help protect the kidneys and again, delay progression of kidney disease. It also has been shown to have cardiovascular benefits, so reducing cardiovascular disease. The fact that we can use these medications and people don't even have diabetes tells us that they're also not going to have a risk of hypoglycemia. And also we do often see a little bit of weight loss with these medications. They are a newer class of medications, so they're all branded and they are expensive in the different diabetes medications that we have. I'm going to go, because I know we're already running over time, go over this very quickly. So these medications, last two, we really don't use too much. Precose was basically something that inhibits glucose breakdown in the intestines. And so because of that, there's less glucose that's absorbed into the bloodstream. Because it's basically breaking down the digestion in the intestines, it causes GI side effects. So flatulence, abdominal pain, diarrhea. They're inexpensive. It is a generic. There's no change in weight and there's no hypoglycemia. Dopamine agonist is the one medication called cycloset. It's very rarely used. It is taken, it's oral, taken with breakfast. The mechanism of action are mostly decreasing insulin resistance in the pancreas and muscle, and decreasing glucose production in the liver. It is expensive, and again, it's just not that effective is the reason why we don't use it. Doesn't have that good of a A1C lowering potential. So insulin, it's pretty short talking about insulin. It's basically divided by the onset and duration of action. We have long-acting insulin, which are Lantus, Semglee, Levemir, Basaglar, Toujeo, Tresiba. So these are long-acting insulin. These insulins help when we're not eating. So they help fasting, in between meals. They're working throughout the day, but as far as when we can tell if they're doing what they need to do is in the fasting state. So these medications, when you're seeing your doctor, if you're on them, we're looking at your fasting sugar to see if you're on the right dose of these medications. So if someone's sugar is 120 in the morning and they're on, say, Lantus, then they're on a good dose if that's kind of their average, versus someone who may come in and we see that their sugars are always over 150. That person likely will need an adjustment on their Lantus dose. Then there's intermediate acting insulin. There's just NPH in this class. We don't use NPH as much anymore, but it is still an option. We sometimes use it when someone's on mixed insulin. It's as a combination of a short acting or a rapid acting insulin in combination with NPH, but occasionally I can use it just by itself. And then the last, the intermediate acting insulin is kind of similar to long acting, but we just would have to dose it more frequently. The long acting insulins are dosed just once a day, once to twice a day, whereas NPH is typically dosed twice a day. Then the rapid, fast, or short acting insulin are basically the insulin that we need in response to the carbohydrates that we're eating. So when we eat, as Mindy was talking about, our sugars rise because basically the carbohydrates are getting broken down. They get absorbed from the intestines into the bloodstream. And then when the pancreas is working well and our cells are sensitive to the pancreas, sensitive to the insulin, we are able to keep our sugars from going too high. Well, when that's not working and the pills that we're taking are not working, then we may progress to needing actually taking insulin, which helps to prevent those spikes after we eat. And there's quite a few insulin in this class. Regular insulin is the oldest one. And then the newer insulins are Humalog, Novolog, Apidra, Fiasp, and Lumjev. So this is just a diagram just showing how the insulins work, or like their onset of action, as well as their duration of action and when they peak. The regular insulin here, and then the, I'm sorry, this is the rapid acting or short acting insulins here, and then the, rapid acting insulin here, and then our short acting insulin here. So you can see the rapid acting insulin is peaking much quicker, and it doesn't last as long. The onset of action is also quicker for the rapid acting insulin. So the regular insulin is going to peak later, 3 hours later, versus a half an hour to 1 hour for the rapid acting insulin, and it's just going to again last longer. This blue line here is showing the NPH. NPH does not spike as much as the regular short-acting or rapid-acting insulin, but you can see that it does still have a spike, and it peaks much later on. So we're talking more like 6 hours that it's peaking, and then the duration is longer as well, sometimes up to about 12 hours. Then our longer acting insulins are Levemir, Lantus, and Tresiba, which basically they're insulins that are lasting 24 hours, with Tresiba lasting more like 36 to 42 hours. The Levemir does not quite last the full 24 hours. And so this is a long acting insulin that's often is dosed twice a day for a lot of people. And then just to give a screenshot of the mixed insulin. So this is when there's two different insulins in one vial or one pen. And so the 70-30 or the 75-25 stands for a mixture of the NPH, which is the 70 or the 75, and the shorter acting insulin, which is the 30 or 25. So it's basically 70% of the insulin volume is the intermediate acting insulin, and either 30 or 25% is the rapid or short acting insulin. And this is generally dosed twice a day before breakfast and before dinner. So just looking at, well, how well do these medications work? How well are they at lowering the A1C? So insulin is what I guess you would say is the best, because we can always put someone on enough insulin to get their A1C down to target. So this is something that, can lower the A1C as much as we want it to lower it. Biguanide, which is the metformin, can lower the A1C from 1 to 2 percentage points. Sulfonylurea is about the same, 1 to 2 percentage points. The TZDs, which are again are Actos and Avandia, anywhere between 0.5 and 1.4%. The glinides, which are nataglinide and repaglinide, or Starlix and Prandin, can lower between 0.5 and 1.5%. Precose were under 1%. GLP1 agonists, anywhere between 0.5 and 1%. And these are the injectable and the non-injectable Rybelsus. DPP4 inhibitors, under 1%, between 0.5 and 0.8. We didn't talk about pramlintide or the bile acid sequestrant. The bromocriptine is that cycloset that we did talk about, which again, we don't really use too much because it's only at most about 5.5% that are lower the A1C. So just to recap, we basically have ways to manage diabetes that include our diet, healthy lifestyle, weight loss, and medications. And that is the end of my talk. Thank you so much for having me, and I'm sorry for going over. And I will be here, just as Mindy said, to answer any questions that you may have.
Thank you. I just want to remind everyone to, in the chat box is a survey. So if you could complete that before you leave, and also the link to recording. So we do have a question in the chat box. I don't know if you want to read it or you want me to read it to you.
Okay, I said I have non-alcoholic fatty liver disease, gastroparesis, take metformin 3 times a day, but it hasn't been helping for several months. Much stress, sleep issues for decades, leg numbness and tingling, taking gabapentin and wondering if that makes things worse. A1C about 8, not sure what direction to go, no luck really with endocrinologists, many sensitivities to medicines too. So that is quite a bit there. And so I'm not sure how much I'm going to be able to directly answer, but it does, again, seem like there's quite a bit of issues going on that could be related to diabetes, and basically related to the A1C being elevated. If there's only metformin that you're taking and optimizing lifestyle with diet and exercise, then it may be something to talk about adding additional agents to your regimen. Then also you do mention about the neuropathy and being on the gabapentin, and so being on metformin may be something to consider doing checking a B12 level. And then with the gastroparesis, one of the things that we do recommend is just having them smaller, more frequent meals to help with gastroparesis. And unfortunately, and Mindy can talk more about this, often with gastroparesis, it's better to have more simple carbohydrates, which sometimes is not the best for managing your diabetes. But if you do it more small, frequent meals, sometimes it's easier for your body to manage those more processed type of carbs. And if you take the advice that Mindy said, as far as having the vegetable part and the protein first, and that may help blunt that response as well.
Right. Right. Some people do better with gastroparesis with liquids, or if they were going to have, because fat also slows down the rate that foods are digested. So usually it's recommended to be on a lower fat, lower fiber diet with gastroparesis. But for some reason, when you have it like in a smoothie or a milkshake, people are able to tolerate that better, just to see if that helps. But I like the idea too, when you do have the more refined carbs, just pair them with some protein, and eat the protein first.
Okay, we had time for like one or two more questions. Does anybody have any questions?
I do see there's one other question. I guess this might be specifically to me though, so I can answer that in the chat, I think. Well, actually, it says to please talk about. So it says, please talk about timing of taking non-diabetes medications for blood pressure, cholesterol, benign prostate hyperplasia, and supplements such as glucosamine, chondroitin, metamucil, CoQ10 by those who take diabetes medication have an A1C between 6 and 7. So generally with these different medications, there's not, don't necessarily recommend a specific timing of them. Generally for blood pressure medications, I do often tell people to split them up if they're taking multiple at a time, if they're taking multiple medications. So if someone is taking more than 3 blood pressure medications, it sometimes is better to split those up, to take one of them later in the day. For diabetes medications, typically, again, most of them are associated with taking them with a meal. And so, we definitely can get into polypharmacy if we're taking, multiple medications at the same time. And so sometimes it is, better to split them up. But for diabetes medications, because, they're acting on the pancreas to help release insulin, and sometimes they can upset the stomach if you're taking them on an empty stomach. So most of the time, those are better to take with the food. And you may want to take some of the other medications a little bit later on, like with a mid-morning snack or, at lunchtime. For the cholesterol medications, those are typically recommended to take at bedtime. They work a little bit better as far as lowering cholesterol when they're taken at bedtime. And then supplements, I don't really have recommendations as far as, supplements. Those, as far as timing, again, just to try not to have multiple medications that you're taking at one time that can increase the risk of pill esophagitis or irritation in your esophagus because of just taking multiple pills, but try to split those up and take them a little bit later in the day.
Okay, there's 2 other questions in the chat box. Is there a location near Newton for a diabetic doctor?
Yes. So I didn't give Mindy appropriately gave our little spiel as far as our diabetes education programs, but I didn't talk at all about our offices. So Capital Endocrinology, we have office in Hopewell, we have one in Lower Makefield, and we also have an office in Bordentown. So there's Dr. Tolan as well as Dr. Ruel that are in the Lower Makefield office that are taking new patients. And the Newtown office that's over by the NAC, that office does not have endocrinology practice.
Okay. The next question, I think this will be our last question. Does turmeric or ginseng help lower glucose levels naturally?
So supplements, there's just not a lot of research on supplements. Turmeric, there is a little bit of like small studies that show that maybe that helps. Mindy, I know often you have include supplements in your talks. You want to take this one?
Yeah, I tend not to recommend them either. I don't know if there's any real significant effect on blood glucose. I mean, I always think it's good to use them as, like spices are great to use. It might decrease inflammation in the body, so it has benefits in that way. Not necessarily as far as blood sugars. I did want to say something about it. The other question was asking about Metamucil. Metamucil is one supplement that I do tend to recommend often because I do think it not only has GI benefits, gastrointestinal benefits for people, but it does also help to lower cholesterol and might reduce blood glucose levels. And I think the best time to probably take that is with meals or about 15 minutes before a meal. So it's in your stomach at the time when the meal is there to help, bind with the cholesterol and help remove it from your body. And maybe keep blood sugars a little more steady. I think it also helps with portion sizes at the meal, because if you drink it with the water before the meal, like Dr. Gillis had said, was a good suggestion about drinking the water before the meal, adding some Metamucil to that can even be more helpful in helping you to feel full.
Okay, and then they asked if you could give the names again for the doctors in Bordentown, and do you have a phone number for their locations?
Yeah, so I'll give you the main number for our office, and they will take care of appointments for all of the locations. So it's 609-303-4300. And the doctors in Bordentown that are accepting new patients would be Dr. Tolan, Dr. Ahmad, and Dr. Villanueva. I'm not sure how long this chat is going to be open down here at the bottom, but I'll put their names down there.
I'm going to leave it open so everybody can do their survey. So,
okay, and Dr.
oh, and then somebody asked for Lower Makefield.
Okay, so the ones I just sent above, I'll put are Bordentown, and then for Lower Makefield, it is Dr. Tolan and Dr. Ruel. And again, you can get all of these offices by just calling the main number, which I'll put on the box, is 609-303-4300, and that's at our Hopewell location.